Hey guys, it's straight to you wellness. In this video, we're talking neuropathy, right? Neuropathy, in my opinion, is one of the most poorly managed conditions in all of healthcare. Very poorly managed. Why? Well, you go in, typically it's a medical doctor, and what do they do for you? Chemicals, take this. Medication, failed. Most of the time, it's a failed approach. They ignore the underlying root cause of why it's there to begin with, right? Is there an entrapment somewhere? A lot of times it can be a nutrient thing, a nutrient deficiency. It could be cell, it could be inflammation, it could be a circulation thing. They ignore the underlying root cause. And that's one reason why we get such great results is that we dig, find, and work towards fixing the underlying root cause, right? Solving the puzzle. Quick background, we have helped patients get healthy, but from a functional standpoint, not guesswork, not more chemical cover ups and pills, potions, lotions, and oils. But let's dig, let's find the root cause, and let's solve the puzzle once and for all. Neuropathy, nasty, nasty thing. It's a big problem for a lot of people. So we're talking numbness, tingling, pins, needles, burning, sharp, stabbing nerve pain, several patients with diabetes as the precursor, and then move into neuropathies, then progress to limb amputations because neuropathy was so bad. Again, this is something that it's very, very common, and so it's very fixable, and it is so poorly managed. Because if you go the medical route, it's just, hey, take this, come back. However, if you look at these medications, there are, I don't know, five or six main medications that they use. If you look at the side effects of some of these medications, a lot of the side effects are dizziness, dizziness. If I can't feel my feet and you put me on a medication that causes, that might not end well. Just saying that might not end well. So we have to look at things from a functional standpoint. So if you want some help, what I want to do is offer you a one-on-one discovery call, and understand that this is not a high pressure, pushy sales call. This is not that. This is simply a chance to ask each other questions. You can ask me questions, we'll ask you questions, and then together we can determine if our protocols would make sense for you. I use analogy of if I'm trying to go from California to New York and I have no map, how successful do you think I'd be? I'd be lost, right? I'd be all over the place. However, if I had a straight line path, a roadmap, a blueprint, do this, do this, do this, let's get this test, let's do this, fix this deficiency. That's what we have with neuropathy. It's solvable, it's fixable, but you got to come at it from the right angle. You have to look at things from a holistic perspective. You have to look at the cells. Your cells make up your tissues make up your organs. If the cells are damaged, if they're broken, if they're blunted, if they're inflamed, if you have inflammation across the board, we have to address that. We can't just take more chemical cover ups because that typically is not the solution. So, if you want some help, book a discovery call. Understand that either myself or one of my medical staff will be giving you a call at the time that you choose. You pick the date and time, we will call you then. So, in your next step, click the button. It's going to open up a box where you can enter your information. And then from there, I'm going to ask you a few questions, and then you can go book a date and time that's going to fit your schedule. So, thanks for watching, and we'll talk soon. Take care.